Welcome. Thank you for joining us for Eye on New Mexico today. We're talking about health care today, specifically the cost of health care. Right now, many of you are probably going through the process of enrolling in your company's health care plan, or maybe looking for an individual policy for next year from an insurance company. My guest is Fred Nathan today, the executive director of the nonprofit think tank Think New Mexico. Thanks for being here, Fred.
Well, thanks for having me back.
And we'll tell you what Think New Mexico is in just a minute, but their latest publication out is called Making Healthcare More Affordable, Increasing Transparency and Ending Price Discrimination. This is their focus for the year here in New Mexico. Obviously, healthcare costs are a huge issue that the federal government has tried to tackle. States like New Mexico have tried to tackle on their own as well. And one place where I think we can all sort of agree to start with is that healthcare costs are just too high, and they have to be controlled somehow. Was that kind of a basis for starting this?
That was really the inspiration for starting it, because as you know, we're on this unsustainable trajectory. A higher and higher portion of the country's GDP now is going to healthcare. I believe it was about 6% in 1980. Now it's about 18%.
Wow.
And you can see it, you know, for example, in our state budget. A higher and higher percentage of the budget is going to healthcare, about 27%, $1.7 billion, and that means less dollars for things like K-12 education, higher education.
Yeah. Absolutely. Back to Think New Mexico, you guys have been around since 1999, I believe.
Very good.
And every year you put out these policy reports, these recommendations, hopefully that state lawmakers are paying attention to. You guys have helped enact changes in New Mexico, including full-day kindergarten, the lottery scholarship. Tell us about some of that.
Well, so we're different. Your viewers are probably familiar with think tanks, but we're different than many think tanks. You know, most think tanks are either way over on the left or way over on the right. And we just believe in a state that's 49th or 50th, Nicole, in too many of these rankings, that the focus ought to be on solutions rather than ideology. And consistent with that, we have a board of directors made up of Democrats, Republicans, and independents. Some of your viewers are probably familiar with many of these people. For example, we have a former Republican governor, Gary Carruthers, now president at New Mexico State University. We have a former Democratic Attorney General, Paul Bardicke. And the chair of our board is Roberta Ramo, who's the first woman president of the American Bar Association. So these are statesmen and stateswomen who just want to advance the state in some of these rankings. And so that's what we do, and we're best known, as you mentioned earlier, for getting a full-day kindergarten law through our legislature, repealing the tax on food, and reforming the lottery to get more dollars to the scholarships and less to the bureaucracy that was running it.
Yeah, so some of the things that New Mexicans have really come to expect, and programs that we all have appreciated over the years and have benefited from are thanks to you guys. So,
well, we've gotten a lot of help from a lot of different people.
And a relatively small group of people, you said, putting the work into creating a book like this, and I'll tell everyone, you know, how to get this too if they want to read it, but this is a lot of good information boiled down into something that is very easy to understand. You made healthcare understandable, which is not easy. Who is working on something like this, and how do you put this together?
So we've got a staff of 4, and we've got some interns that help us over the summer. So we just do a lot of research, and it's not a terribly long report. It's only 32 pages, but it took about 6 months to gather all the information and then to write it.
All right, well, let's go ahead and get into some of the information you were able to put together and how you came up with what you're recommending we do in New Mexico to make these changes. Basically, you know, it boils down to healthcare spending going up, healthcare costs are high, and one of the biggest problems that you cite in the report right off the bat is that we don't know what we're paying for healthcare. Hospitals are not required to divulge that information to myself, the patient, at the beginning before I go get a procedure, and I could be paying something very different than what someone else is paying. So these are problems. Correct.
The healthcare sector is really unique. It's you know, in every other part of the market, we expect for whatever we're buying, like a common household appliance, you can easily find data about price and quality.
Sure.
But a common surgical procedure, not so much. It's very difficult to get that data. And there was an economist at Princeton who studies this, and he says, you know, purchasing health care in the United States, not just New Mexico, is a lot like going to a department store blindfolded, purchasing some things, and then getting a bill 2 months later that's indecipherable, and then there's a little black box that says pay this amount, and we do it. But it's something that really needs to be reformed. Other states are now trying to address this problem and have been doing so for a decade by creating user-friendly websites where patients can go to find out what they can expect to pay for the most common medical procedures. And that's something that we think would work very well in New Mexico and help make healthcare less expensive and more affordable to more people.
Yeah, so states are already doing this, and this would be something hospitals have that information. Someone can get that information already. So this it doesn't sound like it would be too hard to put this into a place where anyone could see it.
That's exactly right. And we've looked at the 14 states that are doing this. And some of them are doing better than others, and we've learned from some of their mistakes. But so, for example, in California, that state requires hospitals to produce everything online. Their entire charge master list, which is like a phone book size list of about 15,000 procedures and products that you can pay for in a hospital. That's not very helpful. We'd like to just focus on the 100 most common procedures, which is something that Arizona does. So that's one example. The other thing that a lot of these websites do is they just put up the price. And most people assume that you get what you pay for, right? There's that common refrain. And that's true in most sectors of the economy, but not as much in healthcare. In fact, we found a number of studies that indicate that price and quality don't actually correlate. And sometimes and people assume if you just give them the price, they'll say, well, I want the best care.
Yeah, so 20,000 is easily going to be better than 5,000, right? That's what they assume.
They assume that, but it turns out that oftentimes the most expensive just means that there's a higher error rate, which is what spikes healthcare costs. So you don't want, so what we'd like to do is give consumers both price data and quality data, like readmission rates, infection rates, error rates, so that patients can find the best value, the best care at the lowest price.
Yeah.
And we believe, based on what's happened in other states, that this would bring down costs.
Going back just a bit, you mentioned the charge master rate when you were talking about California there.
Yeah.
Explain a bit about what we are paying when we go into a hospital for any given service or procedure. There's this charge master rate, but mostly most people, if you have insurance, you're paying some rate negotiated between the insurance company and the hospital, or if you have Medicare, you're paying a rate negotiated by the government. So what are we paying?
Well, this is one of the strange anomalies of healthcare pricing, which is you and I could go to the same hospital for the same procedure and see the same doctor, and very likely pay very different prices, because what you pay depends on who's paying the bill for you. So, and perversely, if you're uninsured, you pay the most. You pay the charge master rate. The charge master rate is what the hospitals use to negotiate with insurance companies, and they do a discount based on how many patients an insurance company is bringing to them. So generally, the bigger insurance companies are able to leverage a better price than smaller insurance companies. And then the people that pay the least are Medicaid and Medicare, because they're bringing the most patients. And they're able to be very efficient. So we've discovered, surprisingly, Medicare is only paying about 94 cents on the dollar for what it costs. Medicaid's about 89 cents. So they're very efficient. And so you have this sort of gradated different pricing system. And if we were, just an interesting thought exercise, Nicole, would be if we were creating this system from scratch, would we really create different prices for different people based on who's paying the bill? And we think this is something that really needs to be eliminated to make the system fairer and simpler. And it would actually save the hospitals and the insurance companies a lot of money, because they have teams and teams of people assigned to just explaining and translating what these bills mean.
So administrative costs, things like that, yeah.
And administrative costs are about 31 cents of every dollar spent on health care.
Wow.
And you can see why it's so high, because we have such a complicated rate structure.
And we'll talk more about getting these prices to be more even and what you guys want to do, but would it bring healthcare costs down? Would it slow the rise of healthcare costs, at least, do you think, to make these prices more uniform?
Yes, because you'd also take out a lot of expense in terms of administration.
Okay, so that's
right. And then the other thing is the website does two things. First of all, it gives consumers the ability to shop around for medical services. And there was a study done by the University of Chicago that compared states that have these websites to states that don't. And what they found was states that have them bring costs down by about 7%. And we think we can bring it down further in New Mexico if we learn from these other websites, and the ones that do it really well is more like 10 to 15%. And so there's the ability to shop around, which we don't have now. And the second thing is if you put quality metrics there, you create a friendly competition between hospitals to lower their error rates, lower their infection rates, and that's what really spikes healthcare costs. So for example, if you go in for an average surgical procedure, it might cost about $8,000, but I saw some data yesterday that shows if there's an infection, that spikes it to a little over $50,000. So you can see Pennsylvania did this 20 years ago. They started comparing all their hospitals on quality metrics, and all the hospitals had to be more accountable. They brought their rates down, and that brings down the cost of care.
Oh yeah, and that's a great point, that putting this information out there is not just telling me, the patient, or everyone else, go look at this yourself. This is telling hospitals, giving hospitals that information about their competitors, giving insurance companies that information about their competitors, so that they have this incentive maybe to compete and try to be the better hospital, be the more, provide better quality, et cetera. Yeah.
That's exactly right. And doctors really appreciate it too, because we've talked to a lot of doctors, and many of them say, we don't know any more than our patients do about the cost of these things. We'd like to have the ability to go to a website so we can advise our patients both on the quality of care and what it might cost them.
That's impressive. We're going to take a quick break, but when we come back, we'll talk more about what Think New Mexico is pushing for our state to do. We talked about the website, bringing these costs to a more bringing them to an even level for everyone, and there are some other things you guys are pushing for, so stay with us. We'll be right back. Welcome back, and thank you for staying with us. A fascinating topic today that affects all of us. We're talking to Fred Nathan from Think New Mexico, a policy think tank here in New Mexico that works on different measures to make life better for New Mexicans. Basically, we were saying, you guys have focused on health care, full-day kindergarten, financial lottery scholarships, food tax, getting rid of that. So all these things that just kind of make sense for New Mexicans. And today's subject, of course, is healthcare costs. And before the break, we were talking about a few of the things that you guys are pushing to lawmakers. Creating a website that puts out price and quality information about hospitals in the state.
And Nicole, I didn't mention, one of the reasons that makes this so timely now is that the country and New Mexico are moving to higher deductibles. And an easy way to explain that is that just means that people are paying more out of pocket, and employers increasingly have to do this to be able, they want to give health care to their employees, but they also need to stay in business and have a profit. So you see more and more people now on higher deductible plans. And just to give your viewers some context, under the Bronze Plan, under the Affordable Care Act, an individual would have deductibles average about $5,000. For a family, it's about $10,000. So now you have consumers more incentivized to be price sensitive, and economists are thrilled because they say this will help to contain costs. But that assumes that consumers and patients have the data so that they can shop around, and that's why this website is so important. Yeah,
that absolutely makes sense. Fewer and fewer of us are able to get on these insurance plans where you pay a fee and you meet a $400 deductible and your healthcare costs are covered and you never have to think about it again. Usually we do have to think about these things.
That's right.
You do have to make that choice. Am I going to take my kid to this doctor visit today? Is it really worth it? And these are tough choices to make, and information, at least if we had the information, it helps us make those decisions. You guys were finding, in putting together this report, Making Healthcare More Affordable, you found some interesting examples where prices of the same service, same exact procedure, performed at two different hospitals not very far apart from in New Mexico, were vastly different.
Yeah, that was astonishing to us as well. So now there's a huge data set that's available through Medicare as to what hospitals charge and what Medicare pays. And so we sort of disaggregated the data and looked at what we thought were the 100 most common medical procedures in New Mexico. And then we separated it out for each of the 44 hospitals in New Mexico. And we were astonished to find, Nicole, that in every case, the lowest price as compared to the highest price was several multiples. And so one example, we pulled out 6 examples, but one was blood poisoning, septicemia. And in Las Vegas, it's about 3.5 times more to treat than what it is in Taos. It's the difference between about $20,000 in Taos, and in Las Vegas it was $72,000. And those 2 hospitals are about 77 miles apart. And that illustrates why a website could be really helpful, so that someone in Las Vegas, in this example, looking at that website, might happily make that trip to save that amount of money. And I'm sure their insurance companies would encourage them to make that trip.
And any idea why these costs are so different?
That's a very it's a very good question, very complicated. I think it's because the charge master rates at these hospitals are so divorced from the actual cost. And the Santa Fe New Mexican did some analysis. They looked at the same data set as we did, and they found that the charge master rates are about 547% of what the actual cost is to the patient. And it's because there's a lot of gamesmanship between the providers and the insurance companies. They negotiate the rates off the charge master rates. So the providers want to set that rate very, very high.
So that they can get the highest then, maybe.
Right, so they can get reimbursed at a high enough level. And to be fair to hospitals, you know, they're under incredible pressure right now. Of course, we expect them to be open 365 days a year, 24/7. We want them to provide charity care. And because Medicaid and Medicare don't really compensate them for their actual expenses, they have to cost shift and they have to charge everybody else more. So I think that's why you see this tremendous variation. And the simple answer to your question is because the pricing system is so opaque, you can do things like this and nobody knows. So it creates a perverse incentive for the hospitals to charge as much as they think they can. And it's not because they're bad people, it's because of this system that we've created that really doesn't make sense for their patients or for them. It's interesting, as we're talking to hospital administrators, they're very quick to point out, we don't like this system any more than our patients do, but we're sort of trapped. And they have to play this game.
And you have to take the money where you get it so that you can cover the areas, like you said, with care for indigents and things like that we do expect hospitals to provide as well. You do have a story in here about a New Mexico man who sought to get that information on his own about why he was being charged so much for a procedure that he had. Tell us that story, because I think it illustrates how hard it can be to get that information right now without these policies you're pushing for in place.
So the person is David Rigsby, and he was uninsured, and he went in actually for 2 operations, a hernia, and I'm now forgetting.
Colonoscopy, I think
it was. And a
colonoscopy.
colonoscopy. And he got the bill many months later and was surprised at how high it was. And so he started asking questions. He's a highly educated person,